Good morning. My name is Michele Monserratt-Ramos. I'm with Consumers Union Safe Patient Project. Why is this issue important to me? My fiance, Lloyd Monserratt, died following elective surgery at the hands of a doctor with a substance abuse problem. Lloyd was a political leader. Like you and I, he believed that he would be safe in a hospital and that our regulatory boards, whose mission it was to protect consumers, would regulate and monitor its doctors in order to protect us, not our doctors. Lloyd was a vote director for the Democratic Congressional Campaign Committee, a director at NALEO, a chief of staff Los Angeles City Council member, a well-respected political consultant. Following his graduation from UCLA, Lloyd even organized nurses with SCIU Local 660. Before Lloyd entered the hospital, I checked Lloyd's doctor's profile on the medical board website. When I checked the medical board website, Lloyd's doctor's profile was clean. It gave me a false sense of security that I had done the right thing. In fact, Lloyd's doctor's background was far from clean. There were no arrests listed, and Lloyd's doctor had been arrested various times, including for felony possession of crack cocaine and prostitution. There were no malpractice judgments, and the medical board knew of 3, as a judgment was listed on his doctor's profile 6 months after Lloyd died. There was information that the medical board had knowledge of, but it was not available to Lloyd or I, and I believed it played a contributing factor in Lloyd's death at the age of 36. When a little-known confidential physician diversion program was abolished in 2007, substance-abusing doctors were moved to the probation program. Today, you will find a significant number of substance-abusing physicians who are on probation. Now, with the confidential diversion program abolished, the information about one's doctor's substance abuse problems can be found on the medical board website, if you know how to find it. You see, the medical board believes that the doctors on probation are safe to practice, and the doctor's lobbyists believe that you should find background information on your doctor on your own. I disagree, and I believe that most Californians would agree with me. You see, we aren't random cases. There are so many cases of substance-abusing doctors who are allowed to continue to practice without their patients having the right to know of their doctor's addictions. For example, a Sacramento ICU doctor showed up to work and treated patients while drunk. The impaired doctor was in charge of life or death decisions in the hospital, treating patients in intensive care while he was drunk. The medical board gave him 5 years probation. He was disciplined again 3 years later for harming patients. He continues to practice today. All of these issues directly impact patient care. It would be something that you would want to know about your doctor before you put your life or the life of your loved ones in their hands. I am here to urge the Appropriations Committee to support SB1033, a bill that will give some of the most chronically ill Californians critical information on their doctor's background, allowing us to make the best possible decisions for our families, a bill that will save lives. Thank you.
Thank you, ladies. That's, now you see the reality.